Welcome back, everyone.
Welcome to another episode of Come to Find Out.
So I am your co-host, Brittany.
And I am your co-host, Yamaris.
So, how's it going? Everything going all right?
Everything is fine. I can't complain, but, I think day by day goes by. I feel like I'm reliving the same day, kind of.
Yeah.
It's going like a circle,
Same
like a
day,
schedule.
same day, different. What is it?
Same thing, different day.
Yeah.
It's
the same.
It's different day, but it's just the same thing. I'm like, when are we going to get out there again? I saw this quote, not even a quote, I call it a meme, that when COVID is over, it's starting to sound like he will change. Yeah, one day he'll change.
I've seen a couple of those. Like,
that thing is starting to sound a little bit like,
whatever it is, it's not coming. So we're going to be talking today about mental health, but specifically around this pandemic.
Yep.
All the names people got for the pandemic.
COVID-19.
Yeah, pandejo, all that.
You got the virus.
All that kind of stuff. Because it's taken, a toll on a lot of people.
For sure.
Myself included. And so we have a special guest with us here today, Miss Ashley Wright. You can introduce yourself. Tell us a little bit about you. Thank you for coming.
Yeah, thank you so much.
No problem. Thank you guys for having me. So I'm Ashley Wright. I am a licensed clinical mental health therapist.
Mm-hmm.
I have been working in mental health for the past 10 years.
Long time.
I've done inpatient, outpatient, and I have my own private practice. I love working with adolescents, but yeah, COVID has definitely taken its toll on everyone in general. So yeah.
So have you seen? I'm just gonna jump right because I got all these kind of questions.
She has all the questions.
Have you seen an increase in your inpatients inquiring about your services in general, or specifically for COVID?
I would say because of COVID, it's definitely increased.
Okay.
You have a lot of, especially the teenagers, their outlets have been taken away from them.
Right.
So you have some who, they have a lot of issues at home, and so their outlet was going to school. That gave them a break. So now that they don't have school anymore, they're stuck at home 24 hours a day with whatever trauma, whatever stressors, whatever triggers that they had, and it's gone. Their friends, it's gone.
Yeah.
You have the kids who are introverts or extroverts, and a lot of their coping skills were going out, hanging with other people, going on walks, going, to the gym, doing whatever it is, doing art. That's taken away from them.
Right.
So now that's driving isolation, that's driving suicidal thoughts, suicidal ideations. That is, you have kids cutting themselves, and then depression altogether. So yes, it's definitely been an influx of all of that.
I know depression has skyrocketed, triple.
Yeah.
I've read after COVID. How's that been with you? What you've handled? Have you seen it getting worse, or just kind of
definitely it's gotten worse, especially with the drugs as well.
Drug abuse has been
the outlets have been taken away.
Right.
So now it's okay, so what
all ages or teenagers?
All ages.
Okay,
yeah. All
that's what
ages.
I thought.
Not just teenagers.
All ages.
All ages.
I know I done had a couple bottles of wine more than normal in my recycling bin.
Right. It's what can you do?
Yeah.
Right? This has been going on. It's about to be March, so it's about an entire year. Right. You have couples who aren't used to being around each other 24 hours a day. So relationships are really being tested. People are really finding out, I really don't like you that much.
I know someone who was going to invite me to a wedding, I believe at the end of last year. And they had been together for 10 years. Oh, and he told me oh yeah, the wedding's off. But I thought he meant they were rescheduling it because of COVID. He was no, they broke up. So you mean tell me they were together for 10 years and then boom, COVID.
So y'all didn't know each other for 10 years?
Just
because think about it. Where's your job is really your first home.
Yeah.
You spend more time at work than you do at home. Yes. You're at home for a couple hours, you eat, take a shower, go to bed, then you get up and you're out the door. So now literally you have to look at this other person 24 hours a day. People are working from home. There's no sunlight. It's
especially in the winter. oh my God. I mean, so for me, I felt my story has been a little bit different in terms of like I wasn't as isolated as most people. So I have, before COVID, I was doing kind of 3 kind of different businesses. I'm an esthetician, so I was doing that. So that got shut down. I do the health education, like I mentioned to you before. So I would go out to the schools. So of course, couldn't go to schools. And then I was like, my other thing was like I did Airbnb. So then nobody was coming, so that was all of my streams of income that were done for. And so it was a blessing. I'm still trying to get out of it now, but it was a blessing in the beginning that I decided to go back to an old job because I just needed some benefits. So I was like, let me go back to one of my old jobs. And so I'd made that decision at the end of January, and I started literally the week of the lockdown in March. And so I'm going out, I'm training, I'm going to work every day. So I remember my mom, she, called me one day and she was like, oh, I'm just checking on you. Cause she was like, of my family. She's like, yeah, I'm really thinking about you and grandma. Cause we're the only two that live alone. That live alone versus the rest of the family lives with someone. So I'm just checking on y'all. Cause you're the two that are like isolated and don't have anyone, living with us and to talk to all the time. And I was like, well, Ma, you gotta remember, I'm going to work. I think at that time, no one else in the family, I don't know. I was going to work every day. I'm not sure whose schedule was affected, but I know I was going every day. Yeah. So I didn't have as much, I don't feel like I've experienced as much of the isolation part. I miss my friends, but I mean, I was going out.
But you were still socializing with people, even if it was, at minimum. But then you brought up a huge thing is that, your income had decreased. Right? You had lost 3 businesses. And that's another change that people have been going through. Like they've lost their jobs. How are they going to pay their bills? How are they going to feed their kids? Right. Their cars are getting repossessed. That's another stressor. So on top of that, you're at home. You don't have a job. You have these kids who you're trying to homeschool. You don't know how to teach your kids. A lot of people don't know how to teach their kids, or they can't, depending on what their kids are dealing with. And then you're trying to help them. They're driving you crazy. You're running around. You're trying to keep them focused, but at the same time, you're depressed. Right. Or
ones who are working, they're working from, the adult is working from home and trying to school the parents.
That's like the teachers, right? The teachers who have kids. So it's like they're trying to teach and
teach their kids. Yeah.
Right.
Like, so I didn't go to school for childhood education. Like I don't know how to teach no kids.
For me, it was like a little different. I had kind of like, I feel like I've had both situations where at first when like COVID started, I mean, I took it serious. I started working from home, but I was still like doing stuff, not around a lot of people, but I was still keeping myself busy. I had people like my close friends come over the house every weekend. Like I was like, I need to keep myself busy and people around me to feel like it's still a normal weekend without COVID. I mean, during the summer, I was going out. I was going out to lakes. I was at little house parties. And it got to a point that I was drinking a whole lot more. And that was my coping mechanism. And not that I was trying out any drugs or anything like that, but either like smoking weed or just anything to like take my mind from it. Because even though I was working, it's not like the career path that I've been wanting to shift into and do full time. And since everything has stopped, now it's like the whole world has stopped. There's not that many opportunities. Everything's becoming really virtual.
Yes.
So it's kind of been hard for a lot of people because I've heard that a lot. Like, oh, I don't know what I'm doing with my life. I'm like, yo, welcome. You're riding the same wave I'm riding. And a lot of people feel like that. Like, I'm not moving. My life is not moving. I feel like I'm repeating the same day over and over and over again.
It's like Groundhog's Day, right? With COVID. Because what really has changed? I mean, you have a lot of people, especially you have, family members who are sick, right? They haven't left the house and they haven't had their kids come over. Or having to find a new career. And it's like, what do I do? But I also think that COVID has been, as much as it's been a bad thing, I think it's also been a good thing, right? Because it's made people sit back and actually take a moment to focus on themselves. Because if you think about it, we're so used to going and moving that we don't take the time to sit back and it's like, who am I? Like, what do I really want to do with my life? People were actually benefiting from the unemployment. And so, didn't have a job, but they have some income coming in. Okay, maybe I can go back and take this time to do what my passion really is. The parents who are working 24/7. Okay, you know what? I don't get to spend a lot of time with my kids. So now I actually get a chance to spend time with my kids. I get to know my kids. I get to know my spouse. And so I think it's always, you know, we have to think about it as changing our language and not always being so negative. And looking at the negative, but it's like, okay, what's the positive? What can I gain from this? And when you change your insight and you change the way you think about things, your mood starts to change, right? And you're like, okay, you know what? It's not that bad, right? It's not the end of the world.
Yeah. And I love that. I mean, especially in the beginning, we were all finding new ways to do things. Because I'm just thinking, like, with our family, we did it. We only did it once. We probably should have done it again. But we did like a virtual like game night. Right. We've never done that before. Like, so and then we had some bumps in the road because we got, you know, all ages. We had the kids and teenagers and up to my grandmother. But we all figured it out. I think we did Zoom or Google Duo, one of those apps. And we all are on there together doing game night. Like that. We found ways, new innovative ways to do things. And so, you know, we all adapt.
You have to adapt, right? Think outside the box. Like you said, you went to the lake, and it's funny. Our culture, right? We don't necessarily. You don't hear about us actually going to the lakes. We don't have lake houses. Yeah. A lot of my privileged children, their families have lake houses, so they have the beach houses, and so it's like, all right. Well, yeah, you know, because of COVID, you know, I can't go hang out with my friends, but my mom and dad and my grandparents, we're going to go to our beach house. I was like, oh,
excuse me.
Nice. All right.
Well, that
go to the backyard.
Nice. But they're like, hey, it's just the beach house.
It's just a beach house.
Like,
I mean, that's what they're used to. So it's like nothing to them.
Yeah. But it's nice to actually see, you know, a lot of, you know, African Americans actually going, like, all right, let's go get outdoors. Let's go for some walks. Let's go to the beach, even if it is for a day or two, or go to the lakes. I'm from Michigan. And so a lot of my family and my friends were actually going to like, they were going up there to the lakes, which is like a couple hours away from us, but they had never been.
Yeah,
like, you've been in Michigan your whole life. Right. You've never been. But they're like at the sand dunes and they're just having fun. I'm like, oh my gosh, thank you guys for getting out and, you know, thinking outside of the box of ways to, you know, be outside, be outdoors, but also communicate with each other, right? And interact with each other. So
yeah. That's good.
What has been like your advice? Like, I mean, like with your job, are you more on the phone, talking to people?
I'm on the phone.
Okay.
My main job at night, yes, I'm on the phone.
Okay.
And a lot of it is because they're so stuck in the house, they don't know what to do. And it's like, you know, my coping skills are gone. The coping skills that I had, I can no longer do. Okay. I'm that's people used to having people around them so much. They're not used to being by themselves. So it's like, okay, so what in the house brings you peace? What calms you down? Is that music? You know, is it going on YouTube and looking up comedy shows? People are so quick to go to the internet for negative things. It's like you can find the most negative thing, or music. It's like, oh, I'm sad. So what do you put on? If you're sad, you're putting on what? The sad music. So it's like, no, like if you're sad, okay, yeah, maybe it may be a song that may make you feel good for a second, but no, let's put on something that's actually going to get you out of that mood, that's going to make you smile, that's going to make you dance, you know, putting on Just Dance, finding a movie, anything, going out into your backyard, start gardening, do something that you've always wanted to do. This past summer, I started gardening with my daughter, and I didn't think that it was something that I actually would enjoy doing, but oh my gosh, I loved it so much. Yeah. Right. We went out and got a trampoline because she can't go to the parks. And so she's in the backyard. They're jumping on the trampoline. So it's really having people think outside of their box and using the things that they already have that they probably didn't even think about before. Yeah. And so usually when you get them to like, okay, start conversing with them and get them thinking about the things that they have, they're like, oh, okay, you know what? I can do that. So, yeah.
Have you had those people that like, oh, well, I've already tried all that?
Oh, yeah. And so those are your people. It's like, okay, you just want, what can I do? Yep. What can I do? How can I help you?
Because you surely did not try every thing.
I've tried it all.
My job is not to give you all the answers, but my job is to support you and encourage you and open up different doors so that hopefully you can walk through it. I'm not here to give you the answers. You know yourself better than I do.
Right.
So I need you to help me. But I'm going to open the doors. I'm going to ask the right questions to get you to thinking. Yeah. Right.
I swore I was going. I went. I saw some, like on Instagram or whatever. I think it might be Twitter. And these girls had all made like these really cute like outfits, and they were all knitted. I said, "Ooh, I'm gonna learn how to knit." I ran to Walmart, got me some yarn and whatever the little needles are called. That yarn's still sitting. Sitting there, unraveled. It was I did learn how to do the loops and the hooks. I don't know the correct terminology, but that was people always ask, "What's a new hobby that you got over COVID?" And it's like, I didn't really get any new hobbies, but I did try.
The sheet, and you can actually look it up. It's called 99 Coping Skills, and it's 99 different activities or different things that you may not have even thought to try and just to do. Whether it's like baking or baking a cake or baking cupcakes from scratch, doing your hair, dyeing your hair, just anything. Like it's so many different things on that list. But it's like I'm like, go to Google 99 Coping Skills. Look through it and circle of things that you may want to try. This is the perfect time to do it. What is your excuse?
Yeah.
What is your excuse?
Had a girl the other day, I just got my hair done the other day, and she was saying like, for her, it was her hair. She was finally able to learn her natural curl pattern, and like because she in the house anyway, like she, she took time and learned how to do her actual curls and learn her products, all that kind of stuff, and like it was kind of her hobby. Like she learned because she wasn't going anywhere, and like you can ride that like awkward phase out in the house anyway. So that's what she told me. It's like, I just spent that time. For me, it's been tough because traveling is one of my coping skills. Like
awesome. I mean, mine as well.
Shrug right now. Like even when I'll just drive to the beach. I'm not even talking nothing crazy like hop on a flight. I'll just drive to Wilmington in a heartbeat and just go sit. Now obviously it's been wintertime, so I probably wouldn't have done it either way if it was wintertime. But I've been itching to do it now.
Especially like when COVID started was in March. It was like nobody is flying.
Right. Like anybody, my family in general, we all travel a lot, but like I ain't been on no plane. Like we did go to Wilmington as a family, and I did fly there, but I mean that's like we was in the air for 10 minutes.
Right.
But so before that, like I haven't been anywhere since last January. That was my last like international trip, and I'm like, okay, I can't go nowhere. I can't do anything.
And that's also like is in your state. What can you do in your state? So North Carolina, there's so many mountains. Yeah. So it's like I've been wanting to get out there and it's like drive to the different mountains and just start hiking. It's like, why not?
Yeah.
What is your excuse?
Oh my God, I feel bad for complaining because I feel like I've been out the country and I've flown and I've been hiking. I went to the beach throughout this whole thing.
No, but that's good. That's good.
Yeah, but I'm like, okay, maybe there's some people that actually haven't been able to do so, and it's been messing like with their heads. And I'm like, I've done it and it's still messing with my head. So I'm just like. That's an issue as well.
Well, it's not an issue. It's as long as you are acknowledging it, you have the awareness to say, you know what, dang, I have been able to do these things, right? I'm blessed to be able to do these things, but at the same time, some things are still taken away from me, right? And that's okay. There's nothing wrong with that.
I was going to ask you, like, even like with people that are now having to be at home, have you gotten like questions regarding like, oh, I was like an extrovert and now like I'm an introvert, like I don't want to even leave my house, I want to be secluded, or I have anxiety, I don't like to be around people, like
they have developed that social anxiety. They have there was a mom actually who was talking about her daughter, her younger daughter who's 8, and she said that her daughter was usually an extrovert. She was always hanging out with her friends, she was always talking, playing, everything. But now she gets online, she will not talk. If they go to the store, she will not leave her mom's side. Like she is just silent. So her attachment, she has this abnormal attachment to her mom at 8, right? Usually 8-year-olds are like off and about. She's like, I don't know what happened. So her daughter has just been, especially kids here, they listen.
Yeah, that's all everybody's talking about.
So, if they're hearing it on the news, they're hearing their parents talking, they get scared.
Yeah, of course.
Right? And they don't know, like, am I going to die if I catch COVID? All these old people are dying around me. I can't go to school. But if I do go, like, what can happen? And so she started to internalize it, and now she's not talking. Right? And you do have the people who have the phobias and the OCDs. I have a friend who she's like OCD super duper clean. Like she says she has a disorder because like she's just that clean. And we are going to Alabama next weekend. Just 3 of us, my close friends, and I'm flying. If it's over 3.5 hours,
she said, I'm flying.
We don't.
I don't drive. If it's over 3.5 hours,
Road
I can't do it. I can't do it. And she's like, well, you're not gonna ride with me? I'm like, no, ma'am. I was like, no, ma'am. And she's like, well, I can't fly. She's like, because all that recycled air. And she's like, you know what? If I catch COVID, I said, listen, hey, she's like, and I can't take all my cleaning products to clean the hotel with me, so I'm just gonna drive. I said, okay, I'll meet you there. The flight is like 30 minutes. I'll meet you there.
She gonna have a whole grocery store in her bag.
And that's just how she is, right?
And that's fine for you, sis. But I'm gonna fly. Like, I understand that that's how you feel, and that's
So COVID has definitely had its effect on different people, especially. I feel bad, especially for like my teenagers who struggle with social anxiety. School, that was like an exercise that we did to get them and working them through getting to school and going up the steps and taking baby steps to get in there. So now it's like, well, see what happens? I don't even have to go to school anymore now. I don't have to leave my room. And society's grown that way anyway.
Yeah,
right?
I hate people.
I hate people. I don't want to be around people. And now it's like, okay, I go to school from home. I can go to work from home. I can have my groceries delivered to me.
Oh my God.
I can have Amazon, have everything that I need in the world delivered to me, and I never have to leave my house.
Yeah.
And it's like, oh, that's so not healthy.
We're so pampered.
That sounds terrible.
Right?
Now, I did do curbside pickup for the first time with my groceries, and it was nice. But yeah,
imagine getting used to that.
To be out. Yeah. I mean, I did it now. I had COVID. And I think I did the curbside pickup right before. But I had it like over Christmas. So for me, it was kind of like depressing because I literally started not to feel good the Tuesday before Christmas.
Oh.
Like I had like a little tickle in my throat. And then that next Wednesday, I had started to have some body aches. I'm like, all right. And Christmas Eve was the next day. And our family, we get together on Christmas Eve. And so I was like, well, let me try to go get a rapid test real quick and make sure before I go, to our parents' house And so they wouldn't give me a rapid test because they said I didn't have enough symptoms long enough.
Which kills me.
I told her, I said, that's not true or whatever. Like, I work in public.
Oh, you want me to lie? Be like, yeah, I did.
And my friend was telling me, he was like, well, say you got the lost taste and smell. Because he had it, and he had it earlier that month. And he was saying, tell them you had the taste of smell, and then they'll give you, because you can just have body aches and it could be anything.
Yeah.
And so, but I'd already said that I had the cough. I had a cough and kind of some aches. And so I'd already told them. So
but that's crazy. They should have they should have tested you because those are like your rollout symptoms anyway.
Right.
So
they were like, you haven't had it? Because I'd only had it at that point since the day before. So 2 days and 2 symptoms. And they were like, that's not enough. And she's like, if we tested you rapid right now, it would come back negative anyway. And I'm just like, girl, all right. So I got the test, but I still didn't know. So now, boom, that's Christmas Eve. I've got to stay home. Christmas Day.
You gotta isolate.
Had to call out from work because I was supposed to work on Christmas night. And then New Year's Eve, I was still out. So it was just like I missed, all the holidays. The little outlets you could have had to see some family possibly, I didn't get to do. And so it was just like, well, all right, bring in the new year at the house. I FaceTimed my mom like a little bit after midnight, but it was just like, all right, whatever with COVID. Yeah. But it, I was blessed that I had a mild. It wasn't that bad. Yeah. But I know people are, very nervous about, you don't know how it's gonna, affect everybody's different, and I try to remember that everybody's handling it different because it has shown me how can act when they are scared. And so I try to remember that with different people I've interacted with, that this is, fear.
And that is okay.
Yeah.
Right. Because you don't know what people's situation is.
Yeah.
Or if their immune system is, or family members or whatever. So everybody has a right to react to it how they want to react to
absolutely.
it. So you just have to be sensitive and to everybody's situation, right?
And then I thought about this just now, but like on top of COVID, right? Because for me, I had to finally admit, I was like, I think I got some depression going on here. And for me, I noticed it over the summer. And I think initially it was so it's like on top of, COVID, you had whatever you were already dealing with life. And so I think it was another situation. But then this summer was all of like the racial tensions. And like, so it was just God, like everything was going on. You got, of course, the George Floyd situation and the Breonna Taylor and every other thing. And so it was just a lot, going on.
This was
and
a
it was
rough
like it was
year.
just sad. I was just sad.
2020 was rough.
2020 was rough.
It was just like, okay, I'm just like, you don't want to. I don't really watch the news like the TV, but for social media, it might as well be the news. So it's like it's everywhere you look. It's death over here with COVID. It's death over here with police brutality. It was just like, where's the escape from? Like, where's the good news? Like, is anything good happening?
And that's where you have to kind of create your environment, right? You got to create your safe space, and your safe haven.
I had to take a step back.
Yeah, you have to.
For me, it was from Instagram. That was kind of the one where I was definitely not as active on there over the summer, and also and it was a kind of a catch-22 with business, because by that time, with me being an esthetician, I was able to open back up by June or July. But I really wasn't in the headspace to be like, it felt
weird,
superficial or whatever, to be posting about, hey, come get your facial, and it's like we out here with like black boxes, and
but that's a good coping skill though, right?
But then that was also affected my business, because I wasn't.
You were.
So then posting. It was like, I wasn't posting, so I wasn't getting clients, and now I'm not getting money, so now I'm getting. It's like it was a cycle.
Yeah.
But it just felt like just silly when this. Not even so much the COVID part, but at that time it was heavy. Like, everybody's riled up about this thing, and this particular, at that time it was George Floyd. I don't think Breonna Taylor had happened quite yet.
Yeah.
But it just felt like this is not important to be talking about.
Yeah.
But then it was just a spiral of more and more and more, and just like, okay. And I was just like, okay, I'm just out here crying all the time. Yeah. That's when I had to realize, like, okay,
it may be a little bit more.
Yeah, it's a lot going on. Yeah. And so, I just know that was kind of I know some of that was COVID, but it was all probably the second half of like 2020 was, for me, it was kind of rough.
Yeah.
And so, like I said, when I looked in my recycling bin, there was a couple extra, wine bottles in there.
How many wine bottles
than normal?
It was funny. My neighbors, they actually live like diagonal from me, but they were outside in their backyard, so I can look over and look into their backyard. And they they went out and bought like a cabana or whatever. And I heard the lady, and she was so loud, but I was like, hey, she was like, you know what? If it wasn't for alcohol, I wouldn't have made it through this pandemic. And I was like, you know what? Like, hey, you get it how you live. If it's not affecting your everyday life and you can still get up and function, hey, you cope however you need to.
Like,
so, I get it.
Extenuating circumstances.
I get it.
I've been around people that have been coping in different ways, so it's been pretty interesting to be like, oh, that's how you coping? Interesting. Someone is doing drinking, smoking, exercising, coming up with podcasts. People are starting YouTube.
Right.
I mean, they're trying to find a hobby,
and that's okay. That's what you should. Like, I know my husband. He's an extrovert, so he likes to get out. Like, he's usually out and about, and he's not used to working from home, but he's been working from home since I think about March as well. And you can just see it on his face. Like, he's like literally like going crazy. And we like pretty much turned our garage into a gym. And although he was doing that, he was like, I can't wait for the gym to open back up. I can't wait for the gym to open back up. I'm going crazy in this house. And I'm just like, okay, as soon as the gym opened back up, he was on it literally every day. And you could just see like his face open back up, and he was happy again because he had another outlet, right? So
I wish I was one of the people that when I get stressed, working out makes me feel better. Like, I wish that was my coping. I'm getting into working out now, but I don't enjoy it. Like, it's not like let me go run to the gym. That's not mine. I wish it was.
My coping one is going out to different restaurants. I just like eating, trying out different restaurants. That's like my way. Like, let's get cute and just go eat, go back home.
And that's okay. Mine is like going to different coffee shops.
Oh, I love that.
I'll go to different coffee shops like every Thursday. Before I actually go to the office, I stop at a different coffee shop and just to go see like what do they have, what's different, if it's something I like, is it where I'm gonna go, repeat. So yeah, whatever works for you. Yeah, that's what you need to do.
Yeah, I feel like I started, even though I'm not like hardcore working out, but I did start going on walks a lot more, especially in the beginning, when it was still, we still didn't really know quite what was going on, and I would just go for walks because I was at my new job, but I had a different schedule all the time, so I would come in sometimes later. like at 11 or 12. So earlier in the morning, I would just go for a walk, just walk around the neighborhood. That's when I would kind of FaceTime different people just as I was out and about. But that was my time to just, because we still were, even though I was going to work, other than that, I still wasn't going anywhere.
Yeah.
Right? So I'm just going to work, go home. So I was like, let me get some fresh air. Like it was March, April, so it was still nice. And I kind of have carried that on. Like I would sometimes go to the park. Like I went this morning, I'll just go to the park and walk around just to be out. Even though it's cold, I just bundle up. But I just need some air.
Yeah.
I think we all do.
And I don't know. I'm going to assume this was like anxiety. I don't know that I've ever like had it before to know if that's what it was. But like I was at, work one night and I just felt like I needed air. Like, and so I just had to go outside and just like, on top of having to wear a mask all the time. So it's like,
oh my
you can't
God.
breathe.
That creates anxiety.
Yeah, like it started because I was just looking for another job because I work third shift and I'm tired all the time. So that was another layer. Like I'm just tired. And so I'm at work looking at jobs and you got the mask on. And then I was like, I could just feel it rising. I was like, I gotta get out of here.
And I went outside. A little panic attack, and it's okay.
Said, oof. And just the feeling like you just dramatic snatch the mask off. Like I just need some air. I felt like my mother because I know she says, I just need some air. But just to go out and just to feel, and for me, I can't do as much because when I go outside, it's nighttime. It's it's 2:00 in the morning. I'm at work, but I just like let me go outside for a second and just do some deep breathing. Yeah, I had to
breathing, some grounding. And that's another thing, also like grounding. I do with my people that call in. Grounding skills with them, and people don't even realize like what's grounding. I'm like, okay, when you focus on just a small thing, whether it's looking at the carpet and looking at the small patterns on the carpet or counting the tiles on the floor, you don't even realize that's grounding. That's grounding you. That's bringing you back into the present moment, because when you are having a panic attack or anxiety attack, you kind of stop breathing, you stop thinking. It's something that kind of gets you stuck. And so trying to focus on something else, or taking a shower. That's another one I tell a lot of them to do. Go take a shower.
Oh, I thought you said take a shot. I'm like,
hey, if you need to go take a shot, but no, take a shower.
You know where my mind is at. I really thought that's what you said. I'm like, oh wow, that's very upfront.
They don't take one shot. They usually end up taking 3 or 4, and then they're calling me back, talking. Who knows what they're talking about?
No, take a shot.
No, take a shower. Like take a shower, take a hot shower, take a cold shower, drink something, eat something. Yeah. Anything that's going to distract you from whatever it is that's going on is what you want to do. So yeah.
Would it be considered? This is a little bit, I guess, tangent, but I saw something a couple times where this man was saying if you were having an anxiety attack, like bite a lemon or something. Yeah. Would that be considered grounding? Because you're focused on it takes your attention off of
eating. Yep.
You can eat anything.
The 5 senses.
Okay.
Any of the 5 senses, when you focus on those, that can take that helps ground you.
Gotcha. Yeah. Okay. I think in that, I mean, obviously that would be taste, but I think they were saying like to just like bite into it because it's so strong, and they were biting even into the skin. Like
but it's gonna it's sour, right? So it's gonna shock you for a second, like
and kind of bring you out of,
or even like smell. You have some people that keep like lavender.
Like eucalyptus.
Yep. Like when I was taking my licensure exam years ago, I realized the first time I took it, I failed it because I was so anxious. I didn't even realize I was like, I have anxiety. Like I had no idea. I was in that, and I knew it. I studied my tail off. I was at work every day studying my butt off, and literally I got in there and my leg was shaking, and I was like, what is going like? But I was so anxious that I ran out of time, and I'm like, I knew this. And so the next time when I went back in there, I had lavender, and I put lavender on my wrist. Oh, wow. And so when I felt myself starting to get worked up, I just smelled it, took a second, deep breathing, went back at it.
Okay.
So yeah,
it's good for stress relief. Right? I mean, that's what it's doing for.
Yeah.
No, that is a good one. I realized I didn't really. I make some body products, and I realized that I didn't like lavender. I thought I did.
What?
Until I started making stuff, and I was like, wait a minute, I don't think I love this smell as much as I thought I did. But I know for a lot of people it is like,
I have a friend like that. She does not like
relapse.
lavender.
And I was like, I was surprised because when I started making them, I made a couple batches of lavender, and I was like, wait a minute, I don't like this, but it ain't for me. Somebody else, might like it. But I love eucalyptus. I love eucalyptus. Yeah. It's like, oh, this is something Vicks.
Good. Vicks fixes everything.
Yeah.
You got a headache? Go smell Vicks.
I heard a lot of people. This is like a tangent, but It's like your family from like
Dominican
Caribbean,
Dominican Republic.
So I've heard a lot of
that's
people.
That's
like,
why I said put Vicks on
yeah,
everything. I'm like, you want me to swallow this, or what do you want me to do?
I mean, we just used to put it on our chest, but I do. I have heard that before. That's why I asked.
Dominicans all the time.
Yeah, my Dominican
Go
friend,
Vicks. I'm like, yo, that doesn't fix my life.
It works.
Life falling apart. Go get some Vicks.
Yeah. Well, Miss Ashley, we really appreciate you coming out, talking to us. Giving us some coping skills and the such. Let us know where we can find you, if you have social media, website.
My baby is like, it's there, it's flourishing. But my private practice is called A Chance to Flourish Counseling. My website, I'm actually working on it. Should be done by the end of the week. I'm not trying. I'm not one of those people that like just put up something just to have it up there.
Of course.
No. So as of right now, you can reach me at, my phone number is 980-272-0651. And also my email is achancetoflourishcounseling@gmail.com. Please reach out to me. I'd rather you call me anyway, so that we can actually talk and we kind of figure out what's going on, how I can help you or better serve you. I work with like adolescents, young adults, men's. I do individual, I do family counseling, all of it.
Do you do like in person or virtual?
I do have an office. So for those who prefer, because right now there are some people who don't want to do virtual. Yeah. So I will go into the office for a couple of my clients, so I'm in person and I do virtual as well. Okay. So yeah.
All right. Well, sounds good. Thank you so much.
No problem. Thank you guys for having me.
Appreciate you coming. We'll take a time for our sponsors. Come to find out, brought to you by Inner Elite Network. Yes. We'll be back. All right. So, Yamaris, do you feel like you personally experienced any changes in your mental health throughout?
Yeah, 100%. That's that's kind of what like I mentioned at first, that I feel like I've gone through different stages of like COVID, where at first I was still like, it was like, oh shoot, this is what's happening, but I wasn't like treating it like it was like nothing, but I was still finding ways to still go out and be out, to keep my mind, just doing something, occupied. So I feel like during the summer, everything I was going out, I was like, AKA, let's say, partying. I was drinking, just socially with the people I had already been around. So I knew that they weren't like, they didn't have the virus. People got tested. And then I think towards the end of 2020, I've calmed down. I was at home. I wasn't being around too many people. I wasn't hanging out. I wasn't doing as much. And that's where I felt like I had to sit with myself a whole lot more. And I mean, I'm 27. I feel like I've already kind of like found myself. It's not like I was finding who I was. It was like, all right, use your time wisely. Right. That's what I was looking for. Yeah. Because at first I wasn't using my time wisely.
Yeah, because it's been,
it's been almost all we had was time. Yeah, all we had is time. And I even decided to go back to school, like take online classes. I was like, why not now? Like everything that I'm doing is from home. If I'm gonna take online classes, are gonna be from home. So that's what I mean. Like I went through different shifts through like COVID. I was good, I was bad, and then it was more so like, all right, come to yourself, like be with yourself. I mean, I live by myself, so it was more so like, what does Yamaris like to do? What does Yamaris enjoy? What do I want to do? What are my goals, to push myself to do them? But I still go out here and there. Like I said, I try out like restaurants. Like that's my way of coping. And I take little trips here and there as much as I can. Of course, safety. So, I mean, it definitely has had its up and down. I don't think I would say I have been depressed, but I have had my moments where I've been really sad. And I've questioned, like, when is this going to end? Or where's my career going? Am I going to grow as a person? Because I get bored easily. Yeah, that's one of my like downfalls. I get bored very easily, and I feel like I always have to be on the go, like doing something, because I'm always like, there's a whole world out there. There's so much more out there, and I'm missing out on it. Yeah, that's how I feel, like I'm missing out on it. And then of course social media, you get on it. I don't really compare myself on social media, but it's like you have those people that look that they're still doing stuff. They're still working. They're still getting gigs. They're still getting money, and I'm like, what am I missing?
Gotta
like, I gotta be doing something. I don't feel like I'm doing enough. So it definitely has had its ups and downs, but so far in 2020, I mean, it's been decent. I can't compare. What about you?
I've definitely bounced back like this year. Like, I've had moments throughout my life. I've had little moments here. I've never felt like I was actually like depressed, but I've had moments, but I was able to pull myself out of it. And so I felt like this time it was way harder for me to pull myself out. But by the end of the year, and it's already that time where you begin to start reflecting, like at the end of any year. So at the end of December, I was like, okay, look, enough. Yeah. Like, it's been 6 months. You took your time. All right. And so we got to start shifting gears. And I think I've done a good job at this point. You know, we're early first quarter of 2021. But I feel like I'm definitely back on the upswing, way better than I was. So I feel like things have definitely gotten better, like 1,000%. Yeah. I still wish I could go to the beach. Because I remember in the beginning when they started to like debate whether to open up beaches and people were going back and forth like, well, you still shouldn't be going to the beach because people are not gonna be 6 feet. Like, it's COVID, blah, blah, blah. And I'm thinking to myself, how is going to the beach different than going to the grocery store? Like, we can still go to the grocery store and you can be spread out. Like, I didn't go to the beach, but I'm saying if I had gone, I wasn't gonna be all up on the next person. So I'm like, to me, the beach would have been the perfect place to go to kind of still be out, but still be separate from people. You can still be with your household. Now, the household part was always the hard part for me, when it's like, you know, you can go places with your household. Well, my household is just me. I don't have anybody else. But, you know, but I'm hoping to get to the beach soon. At this point, I don't even care if it's cold. Like, I need some ocean waves. I've been lately, before I go to work, I turn on on Amazon, they have those like the waves crashing.
Oh my God, we're such alike.
Like, that's
come to find out.
I'm telling you, like, that's just my little way until I can really get to a real one. And it's like on the screen, it's like nighttime and it has like the moon out. It's so pretty. But like, I'm just gonna listen to some waves until I can hear some real ones. But because the beach is like my happy place, and so it being taken away from me was a lot. So hopefully I can get back. At this point, I know they're open and stuff, but it's just cold.
Yeah, I mean, you're gonna have to go down to Miami or something.
Look, and I got a flight voucher. Look, because back when the flight started to like drop at the beginning of COVID, like, so what? COVID started in March. Me and my friends snatched up some flights to Vegas for Memorial Day weekend. So last May, that was cute when we thought it was going to be over by, look, this was in March. We thought it was going to be over by May. And so once we realized that, you know, we weren't going to be able to go anywhere, I have a flight voucher now. That was will be good through the end of December 2021 this year.
Gotcha.
So I'm sitting here like, well, I got to, and I'm really like right now needing somewhere to go. Like, I literally just put some PTO in. Like, I just need, because I work a lot of weekends. And so I'm like, look, I'm about to go somewhere. And I have my moments where I just like to travel like by myself. Yeah. And so I'm thinking wherever I go next might be like a solo trip. Nothing crazy, just like when I go to the beach, I go by myself. Or if it's just, I don't know, somewhere.
Big ups to you for that. I don't know how to travel by myself. I've never tried it. I always had to have at least one person. So big ups to you. I
think everybody should just once in their life.
Well, you
be careful and stuff, but yeah, I had a friend ask me like, "Oh, do you like because he lives in another country, and he was like, "Oh, do you think it's gonna be, you know, you're gonna be able to travel anytime soon?" And I'm like,
"I'm gonna make this happen."
So he lives in Europe, so I'm like,
I mean,
no, we're not welcome there.
No, us,
yeah. So I'm like, no,
really? I feel like I saw somebody go to London and come back
because that's the like the Brexit, like they're not a part of the.
I mean, that's UK.
European. They're not a part of the European Union anymore. So I think we're not welcome, and I could be wrong, but I think we're not welcome to the European Union, and they exited out of that, so we can go there. But we can't go. I don't think we can go anywhere else in the European Union right now.
I miss Paris.
So we can go, like, you know, everybody's going to Mexico, and
I was there. That was my first. I'm out.
Are you in Tulum?
I was in Tulum.
So, yeah. And like I know other places that are open. It seems like it's more like south.
Yeah.
I don't know where else.
Like they had, Cancun is one of them kind of, but but Tulum was the popping place.
Yeah.
The Tulum, everybody, you already knew if you was out of the country, where you at? Tulum.
Yep.
And then Cabo came a thing.
And I know people, like I saw a video, like I was thinking about going to Puerto Rico because thinking it would be still easier. Yeah. But Puerto Rico, and then I was hearing Hawaii, they both were having like, this was kind of like summertime-ish. I think they might have changed now, but you had to go and do a 14-day quarantine.
All right, that's
so it's like, well, I wasn't trying to come here for that long. Like, so by the time you get there, you have to stay for 14 days quarantine before you can even go and do anything. I know, so nice. I mean, who has the time to go somewhere for that long? So, but I think they've eased up on it now. A lot of places you just have to have a negative test within like 3 days. Mm-hmm. I know now if you go out the country and you come back in, you have to have
some places have a like testing sites. I saw like people posting on my Instagram on their story like, oh, we're taking a test, we go back into the States. I'm like,
and some people I've seen they have to do it themselves. I don't think I can COVID test myself. I can't put
wait, how they do? Oh man.
Just put up their nose.
You can do it. You can do. I thought now you didn't have to put it all the way in, because last time I got tested, the girl was like, "Oh, we don't have to go all the way up anymore."
The last time
I was like, "Girl, I got them things up in my nose 3 times already, man. Put them thing in it."
The first time I went, did it. She was so sweet too. Like she did one nostril, and she kept talking to me, and I talked through it, and that helped. The second time, I think I got tested 4 times. The second time I went to that like place where I got a rapid one, and they do both nostrils. And I was like, I wasn't prepared. I thought it was always one. So they do both, but they don't go up as far.
Gotcha.
Or they do, but they do it faster. And then I went to, because I work for like the hospital system here, so they do one. So then I went there and got the one. And the time where I tested positive, I mean, he was all the way up in my nose. And so I'm just saying, if it was like that, I don't think I could do that myself, because it's not comfortable. I feel like it's hard to hurt yourself, and it's not fun. So, but hopefully, I'm hoping, since I've had it, I'm good. You think are you going to do the vaccine?
Why you be reading my mind? You'll be knowing, because I was going to ask him the same question. I don't know who said this. I don't think it was you, but whoever said it, if you hear this, you said it. So quotes to you. We put so much inside our body that we have no idea where it comes from, what it is, what can do to us. Why am I going to be against a vaccine? That I mean, it's the same thing. I don't know what's in it, but every day I'm putting something in my body that I don't know what it is.
And so for me, I was never against it.
Yeah.
I don't know that I was ever like running to the front of the line to get it.
Now, I might be in the back.
Right before I had COVID, because I'm a healthcare worker, I had gotten an email that I could start like not applying, but you like put information in to get in line to get the vaccine. So I think, because I've had coworkers that have gotten it, I think that I could have gotten it relatively soon, but then boom, I got COVID.
Yeah.
And so my only thought now is, I was just talking to somebody about this. Might have been my brother. I don't know. But I was just like, if I had the flu, would I go get a flu vaccine after?
What you think?
I don't think I would.
Because
in normal circumstances. Because the flu, and COVID is, I mean, it's a virus too, but the flu is a different strain, you know, every year. But I'm not saying what this right or wrong. I'm just saying in normal circumstances, if I had the flu, I don't think that I would go back and get the shot afterwards. Now, for me, I've always worked in healthcare, so I generally always get the flu shot. And I'm not, even with the flu shot, I'm not like I don't care. If I have to get it for work, then I'll get it. If I'm not working in healthcare that year, I usually just don't get it. Don't get the shot. But I was just thinking, I'm like,
I have 2 friends that are nurses, and they've already they're in their second shot. Yeah. And they seem pretty normal to me.
Yeah. I know a couple coworkers that got it, and they seemingly, it was consistent that second shot was the one that kind of made them feel like that. Several people called out after they got their second shot because they didn't feel good. But yeah, I'll probably get it. I'm just not as in a rush probably as I would have been beforehand.
I need to read a lot more on.
Yeah, I haven't done
like your research.
My research either. So I always want to do my part and making sure that I'm looking, because I saw some conversations about even my thing was maybe waiting a little bit longer because there are some more strains coming out. So let's make a vaccine that kind of covers more than just that kind of first one. So that, because if I get the vaccine and I gotta go get another one in in 2 months or whatever, but I'm pretty sure I will get it eventually. Like, I'm not anti-vaccine at all. And I probably could now, like I said. Well, after having it, they would want you to wait for a little bit after you've had it
to take it again, to
get the vaccine. I remember when I first got the email about signing up to get the vaccine, they asked you. I don't remember the exact number because I didn't need to remember at the time, but they did ask, have you had COVID in the last something? And I don't know if it was 14 days, which if that's the case, I would be in the clear, or if it was like 60 days. I can't remember, but there was some kind of if you've had it recently, wait a little bit of time. So either way, I probably might still be in that window of waiting to get it, but I probably will.
Right, girl, well, if you get it, let me know. I want to see how you act.
Yeah, I will. I don't think I know anyone outside of coworkers that has gotten it though. Actually,
no, I've only heard like anyone that's in the like medical field that's gotten it. I haven't ran into anyone that's like just like, oh, I went and got the vaccine.
And I'm in healthcare, but I don't work directly with patients. So initially I thought I was not going to be in the front of the line to get it as opposed to the nurses and stuff like that. But at this point, I think all the employees of the hospital system were able to get it. It's like 60,000 employees. So I probably will very soon. I'll keep you updated on whether or not I do.
Because I'm right after you.
And I don't even know how it's been done. You go to your doctor's office. I haven't even looked that far into it. I know they're doing like mass vaccine things, because I got an email from work that they were like looking for people to help. They were doing like a mass vaccine event or something like that. So we'll see.
Well, if you gotten a vaccine shot,
you'll be the first to know.
Let us know, because we sure don't have any much research. We haven't done much research on it.
Yeah, I'll do some looking up some stuff first and take it from there. But I will be utilizing some of Miss Ashley's healthy coping,
so great
coping skills. Like I said, I think I've done much better with kind of getting through that rough patch. But you never know, it could come back. So I'll be utilizing some of her skills. I might try to pick up that knitting again.
I will come to find out that you started a new podcast now, so you got something else to do.
I got them things to focus on. But them outfits were cute. I kind of do want to make.
You gotta show me those.
Because I gotta find it, but I know I screenshotted one of them. But they were like making whole like 2-piece, like just whole, not even like just outfits. Yeah. But they were all knitted. And I was like, then this is what I do though. I see one thing and now boom, I want to be making outfits. Like, girl, how did you learn how to just do the loops before you start trying
getting
to make
good outfits? Because then I'm gonna make you make all my outfits. I need help finding the right jeans.
I just be doing stuff. But anyway. But until the next time, we will see you guys later.
Thank you for tuning in.
Check out Miss Ashley's information on how to contact her if you need her, because I probably will be myself.
For sure. I mean, I know I laugh a lot. That's my coping mechanism. Yeah. But that's like, this is serious. Like, it's a thing.
Yeah, it's a lot going on.
So hopefully in 2021 things would die down more. And we get back to not our old life, but something new. Yeah. That allows us to feel like we're back in the days.
Yeah. Whatever the new normal is, I'm ready for it.
There you go.
All right. See you guys.
Peace.